Problem.
Hi, Silhouettes. I'm here today with Dr. Bora. I just got my cast off, so thank you so much for my nose, Dr. Bora. I'm so happy.
You're welcome. Everything seems very nice. It's just 6 days after surgery,
Yes,
but looking amazing. You already like it.
I already like it, and it's swollen, and I already like it, so that's a good thing.
Rhinoplasty is a kind of surgery that it really takes more than a year for the final result. So it's very important when I talk to my patients, just be patient. But you can see how it's going to look like that, maybe from now, but you will see, even I see my patients in 4 months, 6 months, and I see them again 1.5 years. It makes really difference with time. You need to have wait some time. Even 2 weeks later, you will see everything will be better.
A lot of my followers are just so excited to see my nose. They're like, we want to see it, we want to see it. So like, can you explain to them a little bit about my case? Like, I know that it was an ethnic rhinoplasty, but it was complicated, you know, like, I really don't know, but they want to know.
Yes. Actually, it's about 3 things, okay? First, what do you want? I'm not categorized, when I look your nose, I say, I'm going to do this, do that. I listen what you want. But also, I may have some recommendations. Some of my patients, for example, don't want nostril reduction. So why I'm going to do that? So it's very special. You mentioned me about the tip, but as I told you, when I do the tip, it will be smaller. It needs a little bit, we need a little bit proportional look, and that's why I recommend the cutting the bones, raising the bridge. So all these really make this a little bit complex. Complex means we use some grafts, like rib grafts, some fascia grafts, to build the bridge, and also to make tiplasty. We stitch the cartilage together to make them smaller. We use some grafts, stronger grafts, to maintain that shape. And also we do some defatting of the tip. It's very important, especially with the closed rhinoplasty, because we do not violate the columella. You can do more defatting without safety issues, because when you do more defatting, but not aggressive defatting, I don't mean that, the skin can shrink over the tip better. It's very important. So also we did that. And we make slightly nostril reduction. We don't want very triangular, very small nostrils. So all these things make surgery a little bit complicated surgery. But overall, everything passed perfectly, and everything looks very nice.
Yeah, I was a little bit scared in the beginning about nostril reduction, just because I did not want the nostrils to be pinched at all. And that's a fear of mine that I've had, because a lot of times in the Black community, what we see when we see rhinoplasty, you see like the botched noses of, you know, the multiple Michael Jackson, Little Kim, people that have multiple rhinoplasties from surgeons that aren't experienced in rhinoplasty or ethnic rhinoplasty.
Yes, you're right about. Personally, I don't like to cut more than needed. And I like more rounded nostrils. Even some of my patients want more triangular nostrils, so I try to give them that. But as a doctor, for doing thousands of just black noses, you know, it's my #1 practice for years. With our experiences with the patients that I see every day, less is more. So when we cut less, and for example, if you want more reduction, you can come in 10 minutes, we will do it. But when you cut more, it's not easy to get it back. And because personally also you want more rounded look, but you still want some change, of course. I make nostril reduction slightly, maybe 2 millimeters from each nostrils. And also, as possible, when it's possible, I try to avoid outer scars, and just a slight scar in the nostrils, which is barely invisible even now. Actually, to keep it like that, you need to do more job. Because sometimes people tell me, okay, cut this, cut that. Okay, it's a shorter period of time. It's easier to do that, but to reconstruct something, it takes more time and attention. And we try to avoid that problems to do medical stitching techniques, grafting techniques to our patients.
Now, primary rhinoplasty usually takes about how long when you're in the OR?
It's in my hands 3 hours around for when you take 3-4 hours when you take the graft. I prepare my patients and we wait for anesthesia to everything will be nice for our patients. We don't rush. We make slow surgery, as you see. That's why we don't have bleeding. We don't have so much swelling. I don't remember when my last patient bruised. It's really rarely happen. I like to work that way, so my patients heal faster. You know, when your patients come a long way to have surgery, you will be a little bit. You are going to be a little bit more obsessed about healing.
Yeah.
You must heal very nice. You must heal very nice because you are going a long way. We want everything perfect as much as possible. So it makes your practice more obsessed, more dedicated. Also, it's perfect for our patients.
So post-operative tips on the plane. Should I be getting up, walking every couple of hours? Like, what do you think? Like, will I have swelling because we're on the airplane, more swelling being on the plane?
I didn't have, you know, for years and years, I didn't have any issues about that. But when you come here, especially flights more than 4 hours, 6 hours, I always recommend to walk around, drink a lot of water. It's good to have circulation. You know, you remember that after surgery you have some good compression socks and also you have machine. That's pump, the blood circle is very important. We want our patients heal fast, walk around Istanbul, and also when you fly back 2-3 times at least, I want you to walk around. Actually, it's also for patients who did not have surgery, people who did not have surgery. But for patients, I always recommend that, especially when it comes to other surgeries like liposuction, tummy tucks, BBL, bigger area, it's more important.
Well, for me, I can't stop smiling because like I always wanted to do a rhinoplasty, and for a long time I was actually gonna let the fear of others stop me from doing it, and I just thought like, oh man, you know, don't do it, it's better to just, you know, but I'm so happy that I traveled this distance to do it. You've been so attentive in terms of, I've actually got to consult with you multiple times before we even got to the OR, and then also like patient coordinator has been amazing in terms of always answering questions that I have. So it's, to me, I'm just excited, and I cannot wait to see my final results because I love my results now. So I know that the final results, I'm going to be in love with them.
I hope, I believe that. You know, I make consultations with all my patients before the surgery, without exception. I make online consultation. It's very important. And I have 15 assistants for hundreds of inquiries, hundreds of people who wants to have surgery, and for the follow-up. Also, I make follow-ups whenever my patient wants, online appointment. It's very important, and I never do more than 2 surgeries in a day. Mostly 1 surgery, sometimes 2 surgeries in a day. Those are important points that I find in my practice improves the patient satisfaction also, because when you have surgery, you want to be cared, not just for have surgery and say goodbye.
It was such a different experience, like I was telling you before, because I got there 6 o'clock in the morning, so it was an early surgery, and then you greeted me with amazing hospitality, but Turkey is big on hospitality, you know, so that that was also refreshing. And then just being in a hospital setting, like when you woke up from surgery, like you don't have to immediately be leaving, you know, like you're staying here for 24 hours, doctors coming in, checking your vitals, nurses, like your team is a call away. And so that was an amazing experience to have. Like you don't have to think about just going back to your hotel and being alone and getting pain management already. So the experience was refreshing, and I think that a lot of people think medical tourism and automatically get scared, like I'm traveling to a new country, I may not know somebody there, but you have support within your office.
Yeah, patient's right about it. It's very important to look around about the doctor, about the hospital, and what's happening there. It's very important, and I put myself at my patients. So I try to give as much as possible this kind of care, and I do my surgeries in big hospital, and nurses 24 hours there at hospital nurses, and also I own my personal nursing assistants. So we do practice as a team with our aftercare staff. It's very important to be cared like a person that you travel. Also, I feel myself so so pressure about it, because I know that you come a long way. I'm very thankful, grateful to all people all around the world, and I do my best every time. And even this is surgery. Sometimes small problems can be handled. The most important thing when patients travel for surgery all around the world must know this. You have to take care of this responsibility, because no one takes you to the surgery room, so you choose your doctor. You have to take the responsibility of that. You have to know that sometimes things not going perfect. You have to come another surgery. So when you in a good communication with clinic that you choose, it makes you feel peace of mind. So you don't feel so much stress about it. And I want to give this to my patients.
Yeah, I could definitely agree with you on that. Like there was no stress. There was a lot of times where I would get a text message and it would be hours before I responded to it. Like, for example, the day before surgery, I would be thinking like, okay, I'm gonna get the details. But before I could even respond, she had already sent me the details. And then when I would check my WhatsApp, because I would get WhatsApp when I was on wireless, I was like, they already sent me the information. So a lot of times it's all about customer service and dealing with somebody that really understands that. Because like I said, it took me longer to respond sometimes to the coordinator than the coordinator to respond to me. And that doesn't really happen. It's usually the other way around, where you're waiting on them to get back to you, but that wasn't the case at all with this. And like I said, I really can't stop smiling because my expectations were met. And I think it's hard. I know that surgeons have it hard because people come with wish pictures and expectations, and it's not magic. It's being done by hand with human eye, and a lot of times we as patients, we want exactly like that wish picture. So I know that doctors have hard expectations to meet. So when somebody meets your expectations, it is more overwhelming, because you're like, wow, exactly what I wanted, I got.
Also, don't forget, I have nose job too, so I understand my patients very well.
So there's a relatability there. Like you had a rhino, I had a rhino, so it makes it amazing.